Hello and welcome to Know This Live. I'm Zinhle Essamuah. Joining me today is Representative Lauren Underwood. When she was sworn in 2019, she became the youngest Black woman to serve in Congress. Rep. Underwood, thank you so much for being here with us.
Well, thank you, Zinhle. I'm so excited to be with you this morning.
Yes, and I'm glad we get to talk to you, especially amid COVID-19, because I know that you are a registered nurse and you bring a very unique perspective and needed perspective to Congress. You've created a comprehensive strategy for dealing with the pandemic, and I understand that you wrote President Biden this week. What are you asking he does to combat this pandemic?
Yes. So we know that we've had almost a year of this coronavirus response. And unfortunately, the Trump administration didn't take a science based approach. We have an opportunity with President Biden to center public health measures that will help us crush the virus and protect the American people. So I've asked the president to prioritize robust testing and contact tracing, making sure that every community has access to the treatments that we know help save lives. And as we continue to ramp up vaccine distribution, I'm asking him to help flood the zone, make sure that folks who are the hardest hit communities have access to the vaccine. You know, when we center the science and the evidence, we have an opportunity to save lives, but also we have an opportunity to lower out of pocket costs for the American people, which have been, telling me and my colleagues in Congress they couldn't afford their health care to begin with. So we have an opportunity to do both in this next COVID relief package.
Yeah, and you talked about COVID treatment and making that accessible. I'm mindful that the New York Times vaccine tracker put Illinois at the bottom of the list for states' rollout. Under 5% of residents of your state have received one shot of the vaccine. What are you hearing from your constituents?
Well, there's a lot of enthusiasm for the vaccine, but we just entered what they call phase 1B here in our state, which is those 65 and older becoming eligible to be vaccinated. And so there's all this interest, and people don't know where they can go because their primary care providers don't have it, their health departments are out. And so we are very anxious to get our next allotment of the vaccine that will become available across the country. We just heard from the Biden administration that they have secured an additional, I think, 200 million doses over the next several months. And we're certainly anxious to see that here in Northern Illinois. The key for me is that we've overcome or overcoming this hurdle of convincing people that the vaccine is safe and effective, right? They want it. We just need to get the shots and arms now.
Yeah, and it's interesting to see how much you are pushing for this to be implemented and rolled out
Yes.
well. I'm mindful that you stated that never did I imagine I would be a congresswoman and talked about how you got emotional during your inauguration. Why were you emotional and what was that experience like for you?
You know, being sworn into the United States Congress as the youngest Black woman ever to serve in this body, I was elected when I was 32. And to have an opportunity to work on issues that impact so many people who've not had a voice, right, who've not had real representation is something that I certainly don't take for granted. You know, I am now in my second term and have the opportunity to continue to lead on healthcare issues, to continue to lead on issues to save moms' lives. You know, Black women continue to die at rates that are, 3 and 4 times higher than white women in this country just because we have babies, and that is something that is unacceptable and can't continue forward, right? To have the opportunity to lead and advocate for change is something that is so meaningful to me. And it's the beauty of our system in our country that a regular woman, right, a nurse from the middle of the country could get herself on the ballot and get elected.
And I'm glad you mentioned Black maternal mortality. I know that statistic, right? That Black women are 3 to 4 times more likely to die than their white counterparts. And I know you've advocated for maternal health care and mental health care. What
Yes.
are we missing right now?
Yes. So I've introduced comprehensive legislation. It's called the Momnibus. And last year we introduced it with then Senator Kamala Harris. And this year we'll be introducing it with Senator Cory Booker. And this is comprehensive. So everything from climate change impacts on maternal health, of which we know there are many, and COVID-19, pregnant people who are getting infected with COVID-19 are having some pretty bad outcomes. They're not participating in the vaccine trials. And so we need to continue to offer additional resources there. But then we also know that in many states like mine, Suicide and substance use are huge contributing factors to maternal death. We need to offer targeted resources to address these issues. Incarcerated people are having tremendous challenges when it comes to maternal mortality. We have a lot of opportunities to increase the number of healthcare providers and resources to not just save Black moms, but all women of color. And when you do that, you improve outcomes for all pregnant people. So we call it the Black Maternal Health Momnibus, but this is an intervention that will improve healthcare quality and save lives for women and pregnant people all across this country.
And I'm mindful as you speak that there has been a lot of vaccine hesitancy among the Black community, specifically given the
Yeah.
history of medical racism we know that's existed in the United States. What are you telling people who might be hesitant to get a COVID vaccine?
What I am telling people is I understand how we came to this place and some of the doubts and concerns and worries. I share with them my experience being vaccinated with the COVID vaccine. I got the Pfizer vaccine and only had some, a little sore arm at the injection site, which is normal. And I remind folks that vaccines are safe and they work. And we have the opportunity to not only protect ourselves, but our families, those people that are closest to us, the most important people in our lives. When we get vaccinated, we have the chance to help protect them. And I think that that is such a powerful message, particularly for us as women of color who have, intergenerational families, right? We're often either living with or supporting people who are older and younger than us. And we want to make sure to keep everybody safe.
Yeah, and in your party, you've been described as a moderate Democrat in a party that needs moderates with star quality. And as I understand it, you're not necessarily a member of the House's far left. Do you self identify as a moderate? And why do you think your unique perspective is needed in Congress?
I'm a Democrat. People like to have these labels, and I don't subscribe to any of them. What I can tell you is this: I bring the full weight of my lived experiences to my role in Congress as a now 34-year-old Black woman. I represent a suburban and rural community outside of Chicago, and the ideology of my constituents spans the gamut from the far, far right to the most progressive that you could ever imagine. And so this gives me flexibility to represent their interests. I am not beholden to any one ideology or point of view. And I am here to best serve the 720,000 people that I represent. I think that this perspective gives me the opportunity to work well with colleagues on the other side of the aisle. They know that I bring real credibility when I say, let's work together. They know I mean it. And we've gotten a lot of things done. President Trump signed several pieces of my legislation into law in just my first term. And I think that that track record shows that I can be an independent voice for my constituents and also be effective. Being effective to getting things done, which I think is really what's on the minds of people right now. What are you going to do for me today? We need help, right? And I hear that over and over, and it lets us deliver.
Yeah, and I think your impact has already been seen. I understand you're being groomed as a member of the Big Six, which, for those not familiar, is when freshmen who serve as liaisons to House leadership and attend Democratic strategy meetings and the like.
That's right.
What strategy do you think the Democratic Party needs to be successful moving forward and in the present?
I think that we're at really a point of opportunity. We have a House majority, a new Senate majority, and a visionary president, President Biden, and the Biden-Harris administration that have such an inclusive vision for our country, centering equity and justice, right? And so, what I am hoping to see is that we are bringing people into the conversation. So many folks have been feeling left out of politics for so long, whether you're a young person of color and you might have voted in this past election and really aren't sure what to expect, right? Let's continue that conversation. Or whether you're a rural American and are wondering if there's a place for you and your ideas and the way that you support your family in this government right now. I hope that leadership in the House, the Senate, and the White House continue to take the opportunity to talk to the American people, to show up for all Americans, not just the ones who may share